Welcome to the Clearly Beneficial podcast, the show where we rip off the Band-Aid and explore the future of healthcare, benefits, and the people driving innovation in the industry. This episode is brought to you by Health Next, the company leading the way in helping employers build enduring cultures of health and well-being, reducing medical cost trends, and increasing organizational performance. To learn more how they can help you, visit healthnext.com.
Welcome, everybody, and so excited to be with you today. I have such a great guest. She's someone I've known for many, many years, and her introduction is just great. Her name is Judith Kunisch. She's an author of a great new book on the world of healthcare called The Center of the Star, and it's published by Advantage Books. And I've known Judy, like I say, a long time, and went to college with her sister, Suzanne. Shout out, Suze. How are you? Judy is a healthcare strategist and executive leader and educator with decades of experience across many sectors. A former Fortune 500 vice president and Yale faculty member, she specializes in healthcare operations, economics, and reform. She's a passionate advocate for system change, blending expertise with actionable insights to drive impactful solutions. Welcome, Judy.
Hi, Vinny. So nice to see you, and thank you for the opportunity to talk about my book.
Absolutely. Your book is, like I said in the preamble, really an amazing book. I thought I knew something about healthcare, and as having been a broker for 22 years, but when I read this book, there were insights literally on every page. And so it was a master's degree in healthcare in about a 10-hour read. So I really enjoyed it. So let's start with it. Why did you write the book, and who did you write it for?
Well, good questions. First of all, I did have a fabulous career, and I am a nurse. I started at the bedside taking care of patients. I realized that I wanted to do more, and so I got a master's of business administration, an MBA, and stepped over into some management roles and leadership roles, and had a very interesting career. And I was very fortunate. Near the end of my career, I started teaching people who were in grad school to become healthcare executives, and I was teaching them about the business of this huge industry. And they were fascinated. And I realized that I really did know a lot of stuff. So I started writing it down, and I said, I want to tell people what I learned, quote unquote, in the School of Hard Knocks. And because I learned stuff on the front lines in lots of different positions. And so that's why I wrote the book. And then I decided, well, I need to write this down and publish it. And I did. And I'm very happy about it. And I do want to say one thing right up front. The book is 210 pages. You can either write about the healthcare industry and write thousands of pages, or I tried to keep it readable so that people would learn.
No, it's utterly readable. I think, there were a few moments where I got lost in the weeds, but I'd say on the whole, it was, eminently readable. And I think your point is well taken about, people who are training to be physicians, nurses, anybody in healthcare. I think the number of folks that actually are trained on the business end of healthcare is, it's not part of the core curriculum, right?
Well, that's absolutely correct. At the same time, let me say this right up front. It's the second largest industry and the largest economy in the world. So there's a whole lot of people that are involved in it who are not healthcare providers. And yet they're very much involved with it. They pay for healthcare, they write policies around healthcare. And I wrote it for them too. It's not just for people in the healthcare system. It's truly for everybody. And I also wrote it for users of the system. People, who are using it and say, oh, wow, this is interesting. Is that what's going on?
No, absolutely. I feel as though in my career, having talked to, senior HR leaders and CFOs in organizations and CEOs, this is the thing that is truly mystifying to everyone.
Yeah, sure.
I mean, even though the second that they go to the doctor, they park their brains at the door, and all of a sudden they're in this system that is designed to lead them down this path, and they don't even know where they're going. So they get very confused very quickly. And I took a lot of great comfort in at least feeling like I understood. Some of it was in the book, but there was other bits that I really, really enjoyed. So what should someone expect from reading the book? I mean, what is the value to all the folks you just mentioned? Consumers, insurers, doctors, insurance brokers, and anyone in healthcare. I mean, give me the high level.
Well, I'll tell you, first of all, have a basic understanding of how the parts are. And I divide the system into five parts, and that's where I got the star. It's got five arms. And so each of the parts has a role, a major role in it. But a lot of them don't talk to one another very often, and a lot of them don't know what each other are doing. And yet, when we want to make change, we need to get them all at the table. So that was basically what I did is I said, let me give you an overview of how all these things work. So when you're working on it or thinking about it or listening to television or the news and hearing about it, you have more insight into what this major system is all about. Make sense?
Yeah, no, it makes total sense. I mean, and I think like you said, you hit it right on the head. A lot of, instead of talking to each other, a lot of these segments talk at each other.
Correct.
When you have a provider on the one side and a payer on the other side, and they're negotiating their annual contracts, they're trying to work toward a number that makes them all happy, but are they really talking about what is going to make the customer happy? I mean, this is
Yeah.
the one thing we buy and consume in America that no one knows the price before they go ahead and buy it.
Correct. 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 And the price is different
No,
depending on who you're paying
exactly.
for.
The price is different within the same facility depending on who they have the contract.
Exactly.
No,
Exactly.
it's pretty crazy. So let's talk about the book itself. So I was wondering, who is actually in the center of the story? Who is, I mean, that you just sort of named it from the perspective that was the point of view.
Well, no, what I did is I developed the star years ago. And what I did, and here's my little graphic, I took those five sectors and I had laid them out and I started drawing arrows in between them. That's where I came up with the star. I went, they all are interconnected, and son of a gun, we have a star here. So that's where I got the idea. And then I
Gotcha.
said, you need to stand in the center of the star, no matter where you're coming from, whether you're a patient or a consumer, or you're a healthcare provider, or you're a payer, or you're working in the government and you're working for the Department of Health and Human Services, or the infamous CDC,
Right.
or down here in the industry. You need to, when you're doing things, talk to people from these other sectors. And so that's how I got started on the star. And then I really said, well, what is the purpose of this sector and how do they get the job done? And so that's part of what I write for each of the sectors. So the book is set up. I give a background on how we got to the health system that we have today, and really about the last 100 years. There were major changes
And that was
in.
great, by the way, from a historical perspective. I really, really enjoyed that part of the book.
Yeah, I'm glad you liked it. I'm glad you liked it. And I enjoyed writing it because it goes back to, the 20th century and the beginning sort of the 20th century. And we get into drugs and building the system and building hospitals and changing it. And it responded to changes in science and it responded to changes in the population. So it's very interesting. And then I take each of the five sectors and I explain how they're set up and how they basically work. As I don't get out in the weeds. I really try hard not to. And then in the third part of the book, I identify what I call four paramount issues and that we have to address. And the first one of those is the health of the general population. Um, I I'm very fortunate because there's a lot of data out there. and I was able to get my hands on it. But I also had a colleague who's a librarian at Yale who did all of my footnotes and checking all my data points to make sure they were legitimate,
Right.
because it's a big issue. You've got to have legitimate data. The second one is the high cost of care. Everybody's got issues around it, so I explain behind the curtain what's going on. The third one is this whole concept of a consumer versus a patient. And at the top of the star, I have the consumers and patients, but they're not the same thing. And we can be one of those at all times. It just depends on where we are. And then I address AI, and I write about 8 pages around AI and what it means to the health system, because you bet it's out there and it's just going to be there and be there and be there.
No, I was
So,
super impressed by that inclusion in the book as well. I thought that was super duper insightful. The one thing that I want to start with though with you was the triple aim and the hidden triple aim. To me, those two things were like the light bulb went off. I'm like, why have I never heard of these things before? If and you state in the book that this is, what health systems and others, work toward, why don't we talk about what that is? And, start there, start with the triple aim and then the hidden triple aim.
okay, so the triple aim was developed in about 2004, and it came out of a group in Boston called the Institute for Healthcare Improvement. Very esteemed organization, very esteemed organization. And they said that the purpose of the US health system has three aims. And one of them is quality of care, one of them is the population, and one of them is the costs. And when they first came, they wanted it to be cost effective. And when it first came out, people were like, what? What are you even talking about? We're delivering healthcare, or a patient, I'm getting healthcare. Those things aren't important. But as time started to go by, the overall system, and I mean overall, all five of those sectors said, oh yeah, we are interested in the population. We are interested in quality of care. We are interested in the costs. So it has become, and unfortunately, you're right, people don't talk about it all the time, but they're drivers of what the system's about. In my book and in my work, I created something called the hidden triple aim, which is power, control, and money. And those items are very much a part of the US health system.
Oh,
And
for sure, for sure. I want to add that. I mean, one of my favorite classes in my MBA was a class called Power and Influence. And
oh,
so when you
interesting.
start talking about that in the book, I was just like amazed that was just like you hit it right on the head, because it's really and all of the notes I left grad school with, I threw all those notes away eventually, but I kept one piece of paper, and that was the one from my power and influence class,
Oh,
which was all
interesting.
about, the way, power and influence is managed, and direct power and indirect power. And I
You're
really thought that
absolutely
you
right.
hit it right on the head with
Well, and
the
it's
hidden triple
there,
aim.
and don't kid yourself. It's there big time. And again, I go back to second largest industry and the largest economy in the world. The money is incredible, and the power, and it starts with how many letters you have after your name, but it also starts with who you work for. It starts with the position you have. It's very much, and then who's controlling things. And, one of the things that I've experienced in my career is I've seen some fabulous ideas that have come from people who are on the front lines doing the work. And it never really makes it beyond where they're working. And a lot of it has to do with power, money, and control, because
Yeah.
they're not powerful themselves, and people aren't listening to them. So,
No, no, absolutely. I mean, what strikes me as the triple aim, and you and I think I talked about this in our phone call, but I don't think I've ever heard a healthcare executive stand up and talk about all the things they're going to do to reduce costs. You know, they talk about quality, they talk about patient care, they talk about the new hospital they want to build, they talk about the new gamma knife they bought, but they don't talk about what they're doing to lower the cost of healthcare and or by extension health insurance.
Well, that is a very interesting observation. And I'm listening to you and I'm going, yeah, I think he's right. I don't think I've heard that either. I think people are sensitive to the costs, particularly if they're addressing the users of the system and the cost. And I do write a lot about the media. I don't make the media one arm of the star. I probably should, because the media is so involved. And because the media brings a huge amount of attention to it, but it also is one and done. You know, they put something out there and then they move on to the next thing. And as I write in the book, making change is very much possible. People are trying to do it, are doing it, not trying to, are doing it all the time, but it doesn't get the attention that, you know, the hot button items do, the things that people really want to hear about. And so the media is not, I mean, they're important, they're very important, but I think you have to listen to them sort of, you know, not with a screen, but you have to stop and say, okay, this is one opinion, this is one part of it, this is not the whole thing. And if you're really interested, I need to learn more about it, because I need to learn more about what they're talking about. Makes sense?
I think that the key, what I've noticed about the media, and by extension, anybody doing communications around healthcare,
Right,
is no one understands it. I
right.
mean, they don't
They ought to
understand,
read
let
my book.
alone one chapter in your book, let alone the whole book. You know, so it's
Yeah,
it's interesting
yeah.
to hear the angles that the media take. So let's give a real high level look at the points in the star. Let's have you talk through the different points in the star, kind of, you know, how you define them, and then, you know, one of the things I want to ask you is, you know, which is your favorite? You know, do you have a
Sure.
favorite, or you know, or not? So why don't you go
I
ahead
like them
and
all.
talk about those points in the star from your perspective?
Okay, well, the 5 points I start and I put them at the top because they're the absolute most important: consumers and patients. And I use the word consumer as opposed to customer, because we have an obligation when we're using healthcare, and even when we're not actively using it, to take care of ourselves. And I write about things like diet and exercise, not a whole lot. This is not a, you know, how to do it, but the concept that not everybody is a patient all the time, and that patients tend to be acutely ill. If you have a long-term illness and you're on meds and you're doing perfectly fine, you're a consumer. You're a consumer. So I write about that. The next one I get to right away is the hot button item: payers. And because I worked for a insurance company, and boy, did I learn a lot. I learned about how private health insurance works. I learned a lot about, over my career, public payments, Medicaid, Medicare, all those different kinds of programs. And so I write about how they're set up. I write about how they're structured, the difference between the government and private industry. And I have some good numbers in there for people to get a sense of what's going on. I then moved down to the healthcare providers, and I talk about the healthcare. I write about, not talk, but I can talk. Um, I divide the providers into 2 segments. One is the individual healthcare provider who's giving you healthcare and you're working with. And the second one is the institutions, the hospital systems, big hospital systems, the health systems, the healthcare delivery systems, the huge industry, huge industry. And some of these hospital systems, they're multi-state, they're all over the place. As a broker, you obviously know that kind of thing because you're addressing them. So I write about that and explain that. I then hop up here to the policymakers. Government is very much involved. And I discriminate between the federal government and the state governments, because the feds write a lot of the rules, they do the licensing, but the states execute on it, and then the states will write their own pieces into it. So I give examples of, for instance, I happen to use nurse practitioners. I'm not a nurse practitioner. They do a good job. but in some states they can practice independently, in other states they can't practice independently. Now the feds license them, write the licenses, write the exams, and approve them, but the feds don't say how they can execute their practice. So that's what I talk about on the policy side. And then of course the payments and Medicare, Medicaid, et cetera, et cetera. And I dive into Health and Human Services and CDC and just a little bit about them, who they are and what they do. But they add a lot to the system. They add a lot to the system.
Right.
Okay, and then
Well,
I get
let me just stop you there for a sec on HHS and
all right
CDC.
right
I mean,
now.
that's a whole other podcast. I mean, we you know, given what's been going on, current political climate, you know, we can have a field day on that conversation at some point.
Well, and I'm trying hard to stay away from it because you can imagine it's captured my attention and I have opinions on it. And so I'm trying to stay away from it. But it's pretty tense right now, I
Yeah.
think. The other one is the health industrial complex, and that's of course big pharma's in there, but also it's where they do research, they create medical models. They're very, very important part of our system. And the book focuses on the US healthcare system, but we do a lot of work that influences the delivery of healthcare around the world out of this bracket, because they're doing research, they're creating things, and it's not just for people in the United States, it's for people using healthcare. So they're extremely important, and I have a great deal of respect for them. I want to say one other thing about them because I think people don't realize this, but they get into the price, and I'm going to say it, the price of pharmaceuticals. It takes 10 years to get a drug
Right.
from the scientific laboratory out into practice. 10 years. And people think that they're just, doing it quickly. So a lot of that money goes to support all of that work to get the drug ready to go. That's very high level, and I get into more detail about it in the book, but it's important to understand that the research that's done in this country is extremely important, and it influences not only our country but the world.
No, for sure. And I really enjoyed that segment on the health industrial complex, because there's so much in I would say the last 3 years, as AI has begun to, and you touch on this in the
Okay.
book, as AI has come to start taking root. There are things like AI scribes now that are becoming more ubiquitous in physicians' offices. The doctor asks you, can I turn my scribe on? And all of a sudden, this
Right.
AI starts listening to your conversation and
Right.
makes the doctor's life a little easier. So AI, and there's a lot of venture capital money floating around in that business, looking for a home for medical innovation and whatever. And if you have the initials AI on it, there's a good chance you're going to get some funding.
Yeah, yeah, I agree. I think this is also a personal opinion, but I think the policymakers are way behind on that. And in terms of overseeing it and making sure that the healthcare providers themselves, I think, are very, very careful with it, very careful with it. But I haven't seen much coming out of at the federal level
Yeah,
about AI and healthcare, and
no,
that's disturbing to
absolutely.
me.
No, absolutely. And then I want to sort of segue into the sort of one thing that you and I had talked about, and I said, I jokingly said to you, as a broker, I thought I was in the center of the star, and and I really realized once I read the book that I was not. But the role of the broker and consultant in the healthcare ecosystem. I mean, that when I was, doing what I did, I interacted with clients. I interacted with business. I interacted with providers. I interacted with payers. And so I felt like I was the traffic cop in a lot of ways, because I understood the comings and goings of people. And when a client had a problem with an insurance company, in many cases, I was the first phone call. Or
Yeah,
they
yeah,
couldn't get a procedure approved by a hospital system, I was a phone call, and I was an influencer to help.
yeah, yeah.
So, we've already jokingly said that, kind of ready to write the second edition of this book. I definitely want to help contribute on it. consultant and broker chapter.
Well, I listened to you, and I agree with you. And but I have to say you educated me because I didn't think about insurance brokers and their role around the system. And that's probably why you were interested in the book too, is because you do go to all the different segments of the system and relate within them. And you are much more informed, I think, than a lot of people working in the system about how the system operates, or at least the execution of it, because I'm sorry to say they hit you with problems. I'd like to have they hit you with successes, because there is so much success that goes on. But of course, why would we tell everybody that?
No, I mean, I was in the problem business, and but you just said something I think super important. I'd say, and this sort of hit me at some point along the way when I kind of thought that, for 9% of the population, healthcare is accessible, it's usable, it's
Right.
not affordable necessarily, but it's there. There's a problematic segment of the population, chronic illnesses, acute illnesses, trauma. I mean, things go wrong all the time. The system works, pretty well
Yes, it does.
on a regular basis. Is what
Yes,
I'm
it
saying.
does. Oh,
Yeah,
I don't criticize the system in the book at all. But I don't want to criticize the system.
right.
I think it's incredible, and because I had learned so much about it, that was another reason I wrote it, because I said, "Wow, I've learned stuff that I had no idea." I had one job. I got hired, and it was a new managed care company for healthcare providers. And they were putting this thing together, and they hired me to be the executive director. The first two people I hired had worked for insurers. They were not healthcare providers, they were insurers. And I said, I need you to educate all of us on insurance. They weren't going to be able to get directly to the providers, but they could through this kind of organization. So there's been, interesting opportunities to get people around the table. And that's why I call it the star, because I say when you get around the table, be there with people who are different than you, and then listen to them
Right.
and make sure you listen to them. There's a very famous economist, Drucker, out of Harvard, who said, listen first, speak last. And I start every conversation I would have with these students, I'd put up a slide that said, listen first, speak last. You can learn a lot by listening.
I'm still working on that.
We
So,
all are.
let's fast forward 10 years. Do you want to take a guess at what the US healthcare system might look like in 10 years?
That is a very interesting question. I would say, I have to keep my personal opinion out of this. So I would say, well, we'll go through the paramount issues. How's that sound? In terms of health of the population, I think it will improve. I think that we are doing a good job, a decent job of getting out there and getting to people and making sure that they have access to care. If you go to an emergency room, they have to take care of you. Now, that's not where we want you to get your health care, in emergency rooms. We want you to go to a clinic. We want you to go to a private practice office. We want you to go get your health care that way. But you will never be refused health care, and there is access. The costs, I think, will always be an issue. We bring in more research, we bring in more techniques, we bring in more treatment models. They're expensive. They're expensive to launch. And one of the things I write about is that as healthcare providers, if you've been trained to use these things, you're going to want to use them. You're going to want to use them a lot. And so I write in the book, I say, if you don't understand what somebody's saying to you, say, is there another way that we could do this? Is this the only way that we can do it? healthcare providers are not used to hearing that, but it is important to ask that because it potentially can save costs.
Right.
So I think, do you really have to do surgery? Could I have physical therapy? Questions like that are very important. In terms of the concept of this consumers versus patients, I did go into that. We're obligated to take care of ourselves to some point. And that's what I mean by a consumer. I say people who are customers, you can go buy a product and you don't use it, that's your choice. But if you're a consumer, you do use it. And we either are consumers or patients. And I prefer to be a consumer. I don't want to be a patient because that means I've got a real problem. I like being healthy. And then the final one is the AI and what AI is going to mean. It's going to be one of the things that I've become quite familiar with because I know people that are doing it is they're using it a lot for operations management and managing staff and managing things moving through. And it's being helpful and they're testing it and it's being helpful. It's not diagnosing. It should never be used. You don't want a machine making a diagnosis for you. But you would love to have the machine say, here's our staff, here's our level of problems that we're having, here's the intensive care, going on. Help us with that. And AI will be very, very good. That's what I know people are doing right now. And it's very, very interesting doing operations management. So I think in 10 years, there'll be a lot more of that. And now, technically, that could help reduce costs.
Well, we can only hope so. I mean, all I'm doing is looking at headlines now that this particular year, and I know this for a fact, that this particular year is probably one of the highest insurance increases that people are seeing on an individual level or on a corporate level that they've seen in a very long time. So it's very worrying. So, but that's a conversation.
The same article in the Wall Street Journal.
Yeah. So that's a conversation for another time. So I want to wrap up our conversation. It's been brilliant. I really appreciate all the insights and people go buy the book. I mean, it really is. It's wonderful. It's called The Center of the Star by Judith Kunisch. And it's available on Amazon and other places where you buy books. And before we wrap, Judy, I'd love to ask, I love wine and I have my own little Instagram called Vines with Vinny. And one thing I ask all my guests is, do you have a favorite grape, wine region? What do you like?
Well, that's a very good question. Yes, I like a good glass of wine, and I tend to be on the white wine side. Although lately I've been dabbling in rosé, but here's my thing that I really feel strongly about. I love California wines. And when I go to buy wine, if it's a California wine, I always get it. And I've been to California many times and driven through the beautiful countryside and the vineyards. So I am a real advocate of California wine. And that's
well, I happen to know a guy or 20, so I'll make sure you text me your home address because there will be a lovely care package on its way.
Well, I think that the California wines are delicious.
So Chardonnay, Sauvignon Blanc, do you care?
I like Chardonnays. I like Chardonnay.
All right. Well, that settles it. Perfect.
Right.
Well, I want to thank you again for your time and attention and being willing to be part of my podcast. And I think everybody's learned a lot, and they get the book, they'll learn more. And I appreciate you, and I hope to have you on again because I think this to me was a kind of scratch the surface conversation. If we want to go deeper on a few things, we can come back to it another time. How about that?
Thank you, Vinny. Thanks a lot. Thank you.
Okay, thanks, Judy. Appreciate your time.
Take care.
Okay.
Bye-bye.
This podcast reflects the personal views of the host and guests, not their employers or sponsors.